Andrew, I'm making up special rules for that game.
You're already making special rules?
Yes, just for that game, that championship game.
Rules just for you, Andrew. Everybody else gets a whole set, but you, yeah.
There will be a handicap, and people that have more experience and are better will have to be blindfolded.
We got Andrew. Looks like we have April. Hi, April. Let's see you there. Thank you for joining. Looks like we have Kinsey. Great. And Julie, are you on? I'm not sure I've seen Julie yet. Nope, don't see Julie yet. Give folks another minute or two. Oh, Karen or Kent, let me know if you see Julie jump on here. Okay. Well, we'll go ahead and get started, and hopefully Julie can make it. But we will start as we do every meeting with the Pledge of Allegiance. So please join me. You can stay on mute, but we'll start and open with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We go ahead and sit down. Normally we would stand and acknowledge anyone in the Rotary family that we should keep in our thoughts, and certainly want to continue to keep our fellow Rotarians and Americans that have just been devastated by the wildfires over in Maui, and specifically the Lahaina area. Sounds like there was a building that Rotarians met in. George was sharing a story that is gone over there, and so Karen has sent out some information on a couple areas to help out if you are so able. There's a Maui Fires Relief Fund Donations can be made through the Rotary District 5000. It's with a 5,000 website, and all 9 Rotary clubs on Maui are working collectively to raise money and put donations to work quickly and wisely. The contributions are tax deductible. And then the other was cash for clothing. Donations to assist the 3 Lahaina Sunset members who lost their homes and possessions can be made to our club's 501c3 foundation. So if you are able to, please consider doing some donations there. So are there any others in the Rotary family that we should keep in mind? Okay. Hearing none, we will move forward. Go ahead, Karen. There we go. All right. To our guests joining us today, we will love to serenade and sing as a group. I'm going to go on mute so as to not make everybody leave the meeting all at once here. But either John or Louie, go ahead and get us started with a welcome song.
All right, thanks, Mason. Welcome to our guests and visitors. Welcome to you from Ames Rotary, Naveda, London, or Gay Paris, from far off lands or the USA. We're glad that you are here today. Come back again whenever you're near. Join us and then we'll make it clear. Around the world you will always be. Welcome at Rotary.
Thank you, John. Well done. Okay, well, we're going to get right into it. Really thankful and appreciate our panelists today. And you can see names and their organizations they represent up on the screen in front of you, along with their headshots. And I'm going to do just some quick introductions here, and then we'll get into the discussion and dialogue on youth, and I think we're adding another little descriptor: youth and young adult mental health. So Kinsey, Hauser, and April Ranck, I hope I'm pronouncing last name correctly, serve as mental health advocates for the Iowa State University Police Department. Kinsey and April provide assistance to students, faculty, and staff who are navigating mental health challenges. They serve as the liaison between the ISU Police Department and mental health resources on campus and in the community. In addition, Kinsey and April provide community outreach and education on mental health issues, as well as provide mental health training to ISU police officers. And Julie, are you on? Did she make it on? Okay. Well, if she makes it on, she may be having to attend to something else. But if she does make it on, Julie Saxton has been in the social services industry for over 16 years and currently serves as the mental health advocate for the Ames PD, advocating for those who struggle with mental health and substance abuse. Julie has been with the department for over 8 years, and prior to this was an in-home mental health counselor and supervisor for Lifeline Resources. Julie worked with children ages 3 to 17 to help them understand their diagnosis and work on coping, communication, and attentiveness skills, as well as support and educate parents to be an advocate for their child. And last but certainly not least, our fellow Rotarian and President and CEO of YSS, Andrew Allen. He's a 47-year-old youth YSS is a 47-year-old youth development agency with more than 300 employees, serving more than 20,000 youth across Iowa each year. YSS helps youth stand strong by providing children, teens, and young adults the opportunity to find their voice, make healthy choices, learn life skills, heal with compassion, and grow their confidence through an array of prevention, treatment, child welfare, and transitional services. So we thank you for joining us today. And next up on my agenda is to hand over the microphone to each of our panelists for a 2 to 3 minute kind of high level intro of our topic today, and then we will get right into kind of our pre-prepared Q&A with some of the questions that were submitted ahead of time. So I am going to start with Kinsey. Kinsey, if you wouldn't mind going off of mute and just giving us a quick couple minutes.
Hi, everyone. I'm Kinsey Hauser. I work as the mental health advocate at ISU Police along with April. I've been here for about 4.5 years now, and April and I get to provide a lot of support and resources to our students, staff, and faculty here on campus. That sometimes looks like going on welfare checks with our officers, making sure that our students and employees are doing okay. Lots of different parents, and then also employers, advisors and professors oftentimes call in asking for us to check on people. And so that is one way that we could get called to a welfare check. Also, if that person who's in crisis is calling in, sharing that they are, experiencing something really difficult right now and that they need assistance, we might also get called out for that reason. Mason talked about the different education and outreach that we do. We get to help with different things like mental health first aid. There's a training called QPR, which is question, persuade, and refer. That's a 1-hour mental health suicide prevention training. The mental health first aid is an 8-hour course. So we get to provide those to lots of people on campus and also in the community. If anyone's ever interested in those, please let us know. We can get you connected and signed up for those courses. And then in regards to outreach, we get to do a lot here on campus. We have a couple therapy dogs as well. And so those are really great tools to kind of get students and employees into the office to talk about what's going on and resources that are here in the community and on campus. We do a lot of connecting with therapists and counselors in the area, also with psychiatrists, medication management, lots of different groups and things like that that could be helpful. And so that is kind of what our job entails.
Great. Thank you, Kinsey. April, anything that you would like to add?
No, Kinsey did a pretty good job of describing what we do on campus. One extra thing we kind of do is provide peer support for our officers who may be experiencing some challenges just that kind of go along with being a police officer, seeing difficult things, being in stressful situations. We do provide peer support for our officers as well. I have been in this role for almost 2 years, and prior to that, I worked for YSS for about 14 years. So my heart is always with YSS.
Wonderful, wonderful. What a perfect segue. It's almost like we practiced that to hand the microphone over to Andrew to give us a few minutes of kind of high level from his perspective.
Yeah, if there's one thing that keeps me up at night more than anything else, and George probably remembers, it's turnover. Like, this field is, just so important. We want the best and the brightest, but the silver lining to turnover is great people like April get leadership positions at, places like Iowa State, and could not be more proud of her and all that she's accomplishing across the community. Really grateful to be with friends today and have a seat at the table. I think that the few things that maybe I'd start with is a thanks to Mason. I think Mason is being really intentional about his tenure as president and trying to focus on, something that will create impact. And there's just not one of us that sits here today who is not impacted by mental health, and our next generation are suffering unlike any other time in our history. Of course, I'm not privy to go back to the over all of the history, but the Surgeon General just 2 years ago said we are in the midst of a mental health crisis for youth. And so he put out an advisory, and I do feel like conversations have ensued there's never been a better time to address what's going on right now, because we have made huge strides over the past 3 years with the pandemic, talking about how important mental health is. And so as it relates to stigma, we've done a great job. We're having conversations at Rotary. We're talking about all of the things, and there is still a lot of work to do. I presented to Rotary a year ago, and I'll just remind you of some of the statistics. It's 36% of all youth in Iowa in middle and high school have experienced hopelessness almost every day for 2 or more weeks. So, more than a third of our youth in middle and high school could be diagnosed with severe depression. 27% of our females in middle and high school, more than a quarter, have thought about killing themselves in the last year. Of that, 50% had a plan. Of that, 23% had actually attempted suicide. So the numbers are 1 in 20. 5% of our youth have actually attempted suicide in the last year. And I saw a Department of Public Health put something out just 2 months ago. I'm trying to verify the facts. They've got it at 10%, 1 in 10. So 2 youth out of every middle school and high school classroom starting up last week in the state have tried to take their own life. And so there are just a lot of things at play. I'm excited to, share some of my thoughts and just see the momentum that could be built through Ames Rotary and the impact that we might have. I'll finish by just saying I want to clarify also that mental health and substance use disorder are oftentimes correlated under a field called behavioral health. So mental health is a piece of it. When you hear behavioral health, sometimes that can be confusing. It's like, oh, like bad behaviors. No, behavioral health is the field of mental health and substance use disorder together. And the state just made a big decision a year ago to combine the 2 departments. Department of Health and Human Services and the Iowa Department of Public Health have combined into a single agency called HHS, Health and Human Services, because they know how correlated mental health and substance use are. So really excited about the conversation and appreciate everybody's interest.
Thank you, Andrew. And Julie, I think you're on now. Can you hear me okay?
I can. Can you see me?
We cannot see you, just see a black screen.
Oh,
But we can hear you.
okay. My apologies for getting that on the
The audio is a little tough to hear.
Okay, what about now?
Sounds a little better. Let's give it a try here. So I did give your bio and then had given the panelists just a few minutes to kind of introduce kind of what you do and your perspective here. So why don't you give it a try before we jump into the questions?
Yes, thank you so much for having me. My name is Julie Saxton. I am the mental health advocate with the Ames Police Department. I have been in this role for almost 9 years. My job is to connect those individuals that come in contact with law enforcement who are struggling with mental illness or substance abuse with the appropriate resources here in our community, specifically then as it relates to our youth. Certainly referring to, YSS for medication management, therapy services, just connecting people with support. We certainly know as a police department that jail is not the place for people who are struggling with mental health or substance abuse. And I certainly will do what I can to make sure that we get a support system for those individuals that are struggling to help them on their road to recovery.
Thank you, Julie. Okay, well, now we will transition into the Q&A. So if you do have questions during the course of the chat or discussion, please use the chat feature in Zoom and just type your question in, and we'll make sure it gets addressed. So we'll start with kind of a basic, which kind of the high level, which we've kind of started to do. And Kinsey and April will let you bat lead off here. On this particular one is why do you think mental health is an important topic for our community to address, particularly for our youth? Kinsey and April, go ahead.
All right, I'll start us off. Well, kind of just going along with what Andrew was saying, it truly is a crisis, that we're dealing with, especially when we talk about mental health for youth. We also have to look at the number of providers that are available. We don't have, I think we talked about this the other day, we have one child psychologist in the city of Ames. We don't have the services that we need, particularly for youth. And with any intervention, whether that's an academic intervention or a behavioral intervention, the earlier that we can get that treatment for that individual, the better outcomes we're going to see. And so being able to have resources for children and youth is really, really important to make sure that we get better outcomes.
Excellent. Thank you, April. I think that's a pretty staggering number. One child psychologist in Ames for this large of a community. So thank you. We'll just kind of go from panelist to panelist. Julie, same question. Why do you think mental health is an important topic for our community to address, particularly our youth?
Well, we know, 1 in 4 people will be diagnosed at some point in their lifetime with mental illness. So it affects so many of us. But as it relates specifically to our youth, the last few years, we have seen as a department, myself, just a huge uptick of mental health related calls for service that involve our youth, that specifically dealing with people that are suicidal. I'll just give you some statistics here. Last year, I had 2,800 calls for service. I responded to 2,500 of those, and 20% of those calls were individuals that were actively suicidal, and a lot of them were youth, 14 to 24 years of age. So this is something that, although is very difficult, right, to talk about, I think it's important that we talk about that because our youth are dying, and we need to do whatever we can to help support, again, find resources, and connect them with folks that can support them through their recovery.
Thank you, Julie. And I'm going to ask a tough question, and not to be flippant about it, but just let's discuss, right? Let's use this as an open forum. How many actually completed the act and committed suicide? Do you have that statistic?
Yeah, I don't have an actual number that I can give you. I can tell you that it's been a couple years now. We had multiple students, Gilbert, Roland Story, Ames High School, who died by suicide. Too many. And it continues, right? Our kids are thinking and talking about suicide. Our kids are struggling with mental illness. And we need to be able to talk about that. I go back to my statistics, 150 calls usually per month. And the majority of our calls at the police department, I would say over 50% are mental health calls.
Yeah, some pretty sobering statistics. And Andrew, you quoted a few to us. So to kind of help us land this question, why do you think mental health is an important topic for our community to address, particular for youth? Anything you would like to add?
Yeah, I think we've had good conversation already. The one other statistic that I think is just enough to make you somewhat upset is from onset of symptoms to treatment, on average is, anybody want to guess how long it takes before someone starts to exhibit symptoms before they get treatment? On average is 11 years. So 11 years that you exhibit and have to endure symptoms before somebody is able to make the connection to treatment. Now, if you had a broken bone in your foot, like how long are you going to walk on that before you go see a doctor? I've got a spot on my skin here that I feel like, gosh, I need to get that looked at. And so everybody's telling me, my wife's saying, hey, you got to go in and get that. My people at work are saying you got to get that looked at. Like physical health for some reason is really accessible healthcare, and it's talked about regularly. Mental health is not as much. And so I do think that if you think it's 25% at any one time, and I think it's like 50% over the course of a lifetime will have a mental health need. And so if 25 to 50% of us, half of the people on the screen, or a quarter this year, are experiencing a mental health need right now, let's start talking about it in a way that normalizes it and makes treatment accessible. I heard the child and adolescent psychologist, that's the child and adolescent psychiatrist, George might know. I don't know when the last time Ames had a child and adolescent psychiatrist. There are only a handful in the state. And so I do think that, Mary Greeley had previously, I'm not sure if Brian or Gary are on, had an adolescent psychiatric unit. I spent 9.5 days there when I was a kid getting treatment. They just opened an expansion, but it's focused on adults. So even today, we have to go to Des Moines to identify adolescent beds from a psychiatric standpoint. So I continue to think, as was shared, accessibility through providers and just normalizing treatment is going to be important.
Great, thank you. Andrew, we'll stick with you to bat lead off on this question. So, and you just mentioned, as others did, some of the challenges specifically with some of the resources that we have. But what challenges do you think young people face when seeking mental health support in our community, and or what are some of the maybe contributing factors, maybe technology being one of them? But talk about some of the challenges young people face when seeking mental health support.
Yeah, the mayor a few years ago, I think he got the idea from Dr. Winterstein. We're reading a book kind of about the digital age and how screen time was impacting mental health of today's youth. There's another new book, Dopamine Nation, that I'm in the middle of reading. Stanford psychiatrist Dr. Lemke is really talking about this thought process of the pleasure paradox, where our bodies are always working towards equilibrium. Like we're trying, if like we're excited, our bodies are bringing us back down. If we're down, our bodies are trying to bring us back up. And essentially, if you think about the life that we live today, we have abundance. While a lot of people are struggling, we also have easy access to these screens. And every time you scroll up on the screen, it releases an endorphin, dopamine, that stimulates your brain in a way that gets you addicted to the screen. I'm addicted. I'm a recovering drug addict and alcoholic, sober 27.5 years, yet I still go to this little screen because it's given me a hit of dopamine. And I think that all of us have nuance in our life where we're pursuing things that make us feel good. And so the essence of this book is we're in a heightened state of pleasure all the time. So our body is pulling us down, looking for equilibrium. And the reality is it is the source of much of the anxiety and the depression that exists today. So trying to figure out what are the ways that we can connect beyond screens? What are the ways that we can, connect with neighbors and community? What are the ways that we can pursue relationships that are, the root of happiness and joy, as opposed to some sort of artificial stimulation, of which is actually the leading contributor to much of the anxiety and depression. So I think that, it's the timing is right. The conversations are happening, and the more that we understand kind of the root of some of these issues and the availability of resources, the more people are going to start pursuing treatment.
Yeah. Thank you, Andrew, for that perspective. I do find myself a bit of a hypocrite at times, because I too often go to my phone for whatever, not only do I use it for work, but just personal, right? And going through Twitter or ESPN or whatever news, etc. And then look at my kids who have, technology at their fingertips and telling them, hey, you need to put that down, when I myself am not really modeling the behavior I'm expecting out of my kids. So, a bit of that can certainly start with me, and some stricter parameters around that, but totally understand where you're coming from. Kinsey or April, anything you would like to add to the conversation on whether, albeit technology or other challenges facing our youth and young adults?
Yeah, so one of the statistics that I wanted to share with everyone too, in regards to our young adults, our college students, and this is not just for Iowa State, this is really nationwide, is about 1 in 3 students experience some sort of significant mental health concern while they're at college or at university. And we do know that less than half, about 40% of those people, actually go out and seek support. So like Andrew said, a lot of that goes back into the stigma. It takes that 10, 11 years to actually go and get help for what you're experiencing. But we also know here too, like our students come from all over the US, all over the world. And so we take a lot of cultural considerations into play as well. So a lot of times we have students who might come here sharing that, my parents were really the kind who didn't talk about mental health. That's not a thing that exists in my family's home. And now I'm experiencing this big concern, and I don't know what to do. Maybe I'm scared to use my parents' insurance to go and seek help, to go get medication, or to go get counseling, or to go to the hospital. And sometimes we do have students navigating those really big concerns. So yeah, we do know that stigma goes along with not being able to go and seek support. And all of that. We try to make it so that our services here are accessible for people. It doesn't cost money for people to come in and see April and I. It doesn't cost money for individuals to go to student counseling. They don't take insurance and things like that. So hopefully stigma can be reduced. And we do know too that a lot of our students that are here are talking about these mental health resources. We definitely know that, they're hopefully sharing them with their friends. We have resource cards that we hand out, and we make sure that people that we come into contact with have numbers for crisis lines and have our numbers, so that just in case something does come up, they can reach out if they are stuck in some sort of mental health concern.
Great. Thank you, Kinsey. I think about my own experience just growing up, right? In the time that I did, I was born in, 1982. So folks can do the math on that. I don't remember ever hearing about this topic growing up. I mean, not that I remember a lot about when I was a kid, but certainly don't remember mental health. You only thought about folks that were mentally ill, right? And they belonged over in some other part of society, removed from, polite society or what have you. So there was certainly some stigma around it, and I certainly didn't want to be, categorized in that. But really, if you had an issue or a problem, it was just suck it up, pull yourself up by your bootstraps and get to work, and never even bother to give it a second thought of, that there may be some underlying issue that needed some attention, right? That, like as Andrew mentioned, if you had a broken foot or broken bone or a spot, like you'd go to a doctor right away. So no, I appreciate that perspective. Julie, anything you would like to add on challenges young people face when seeking mental health support in our community, or technology or other kind of active drivers for some of this crises?
Yeah, so to piggyback off of what Andrew said, I completely agree that technology plays a really big part in the decline of mental health, obviously for adults, but specifically as it relates to our youth. Couple other things that I like to mention. Certainly a lack of resiliency and inability to cope with life stressors, I think, is a big contributor to the decline of mental health in our youth. I see a lot of young people that just truly do not have those coping or resiliency skills. And that is very concerning. Cyberbullying, again, we can apply that back to technology, where very easy for kids to be able to say whatever they want to say behind a screen. And then we see that play out again as it relates to mental health. I see in our community, we have so many great providers. I think a huge barrier, stigma, we talked about that, but we just don't have enough providers. I mean, that's just kind of how it is across the board. Again, we have many great providers in this community. We just don't have enough. We talked about medication providers, medication management, therapists, social workers. When you take a look at the number of people that are struggling and then compare it to how many people that we have to help, we just need so many more to be able to, I would say, effectively support. I think there's this Band-Aid approach out there, not because we want to do that, but because we simply just don't have enough bodies. One thing I also want to mention too is the mobile crisis and the ARCH program, our new crisis response team. I'm really pleased that we have these resources here in our community, so folks can talk to people and have these individuals come out to where maybe they are having that crisis or just struggling with their mental health, and they have somebody that they can talk to that can get them connected to those resources.
Great. Thank you, Julie. Well, Julie, we'll stick with you on this one. Deb Shildroth dropped a question in the chat. And so Story County is one of 15 counties in the Central Iowa Community Services Mental Health Region. The region has responsibility around planning, developing, and funding children and youth mental health services. What initiatives and/or collaboration is occurring with the region regarding access and availability to treatment services? And if you don't have an answer, we can certainly look to the other panelists, but wanted to call that out. Thank you, Deb, for your question.
Yeah, thank you, Deb. Can you repeat that question for me, please?
Yes, it's in the chat. If you're able to pop that up.
I'm happy to start.
Go ahead, Andrew.
Go ahead.
I do think that the mental health region, Central Iowa Community Services, CICS for short, is an I don't want to say underutilized resource, but not a lot of people are aware of the region and the role that it plays. And we've got the CEO of the region recently relocated to Ames, Russell Wood. He works out of the Story County Administration Building in Ames, or the Human Services Building. And they are the coordinator of services for that 15-county region. So one major initiative is once in a generation investment in Ember Recovery Campus, so the 70-bed substance use disorder treatment program, emergency shelter, crisis stabilization, located on 50 acres just south of Ames in a rural setting. They're the reason that project was able to push forward. We're a year into construction. We've just got one more year to go before we cut the ribbon and invite all of you to attend. But it will be, best in class treatment in a residential setting for youth from Central Iowa, Story County, but really across Iowa. And they're also working on an access center. So it's one of the core requirements. And they're deploying a virtual access center. So there'll be 10 provider organizations, a couple in Ames, including YSS, Mary Greeley, Irely Ball. I might be missing another one, where there's no wrong door. So anybody that presents at any one of these partner organizations that's creating a virtual access center will have the network of resources available to be sure that we get the person to the right place. So while YSS might not be able to serve them, if they present at YSS, we're going to get them connected with services. So there's still in its infancy, but there've probably been half a dozen meetings. They've been working on this for a year. They've got money to get it done. And I would expect people to hear more about an access center. That's one of the core requirements for the region.
Great. Thank you, Andrew. I'll open it up, Julie, April, Kinsey.
I don't know that I can necessarily speak on that.
Okay.
You know, the region used to be an asset agency, and they pulled out a while ago. I think at the time that it happened, it was like confusing, like, hey, wait a minute, asset's such a good thing. Why are you guys pulling out? And they just had a different focus because they exist in 15 counties, not just one. I will tell you this as a story. I didn't even know the name of the CEO of the region for my first 5 years of my tenure. And that's because they didn't focus on kids. And it was a bipartisan legislative effort that got the governor to sign the legislation to create the Children's Behavioral Health System, where essentially all she did was say, or all the state did was say, hey, region, focus on kids. And when they did, it opened up a flood of potential resources and this relationship to the region to support Ember and lots of other things focus on kids. While the majority of their funds go other places, it was one small act to say kids matter that changed the way that they operate. And so I think that, you know, another thing coming out of conversations like this is where are we just not thinking about kids? Where are we not thinking about youth? You know, all the way up to 24 is what I think about, while the, you know, your frontal lobe is still developing, because one small act can have a big impact as it relates to resources and conversations and moving the needle.
One thing I do want to bring up regarding initiatives, because of the mental health crisis in Story County a couple of years ago, I sat down with Deb Childreth and the mayor and our chief of police. And last year we had a series of community conversations. And each month was a different topic. And we discussed, talked about suicide awareness, mental health resources in our community, substance abuse, resources in our community. So folks would have an idea of where they could go, what these programs are, and also to destigmatize, right? That, you know, we want to make sure that we're talking about mental health, bringing that out into light. And the last conversation that we had was in June, and it was civility and conversation. And I just noted somebody's question about today's political environment on mental health. And one of the reasons that we had this topic, and we had a moderator come in, we talked about how do we talk to one another when we do not agree? And how does that relate to our mental health? Well, we know that there's a direct correlation. There's so much anger, there's so much animosity. And of course, that is directly related to our mental health. So when we had that last discussion in June, the hope was that, you know, we kind of go back to let's form relationships, get to know people, and, you know, go back to being able to be active listeners, being able to respect one another's opinion. And I just sat down again with the mayor and the chief of police, and we'll be meeting with one of the assistant principals with the school district. And our hope is that we would have another couple sessions in the high school and middle school, and talking to kids about just because you don't agree with your friend over here doesn't mean that you cannot be friendly. And we'll be talking about how that impacts their mental health. So hoping that we can get that going this year.
Great perspective. Yeah, I would maybe tie this back to, technology and social media, right? And Facebook and Twitter and Instagram, Snapchat, whatever all the programs are with social media these days, how easy it is for us to get into little battles, with our fingertips, specifically on politics, for example, that, I would imagine the same type of conversations, or at least that tone is happening, with different points of view with our youth and how that impacts mental health. And Jeff's question, I think, was, is there any research on it? I don't know if there's any studies that have been, formalized yet that any of our panelists are aware of, other than just kind of anecdotal experience. But, okay. Another question in the chat here says Mary Greeley is opening, from Melissa. Mary Greeley is opening an updated and expanded behavioral health unit soon. I toured recently and learned a little more about the additional space and thoughtful planning that went into designing that space. What impact will this new space have on our community from your perspectives? I'll just open it up to the panel, and whoever wants to take it can go.
We can talk about this. We've also had the opportunity to tour the facility, and it really is beautiful, and our community is really lucky to have it. While I think it's going to have a great impact on our community by being able to serve adults, it's not going to be able to serve youth. And that was kind of just what I was thinking the whole time I toured this. I was thinking, why can't we have a youth facility? And I know YSS, we will soon have one, and we're looking forward to that. But for youth right now, the process, really, when they are experiencing a mental health crisis, they sit in the emergency department until they can find a place for them. They may be sitting in the emergency department for days with another individual in the behavioral health room with them. When they finally do find placement, that placement is Bettendorf or Council Bluffs, really far away from their support system and their parents or family, whatever that may be. And so while Mary Greeley's behavioral health unit is wonderful, I just wish we could also just copy and paste that and have that facility available for our youth, because it's really important.
I'll also just share, and this is maybe not fair as it relates to, piggybacking on Mary Greeley, but the business model for youth is not a good one, generally speaking. The idea, for YSS, for instance, from a substance use disorder treatment standpoint, like, we've got one shot. Adult treatment centers can provide treatment 20 times to somebody, every year in a successive year. And so it's important to think about how we invest and give providers, YSS, Mary Greeley, whomever, additional resources to think about this specialty care for kids, because it's not a model that always works from a financial standpoint. And so, the advocacy that's taking place at the Capitol, there have been recent, the expansion of services through the mental health region, and then just continuing to think about how do we compensate specialty providers focused on kids will be great. I see Gary popping on, 18 plus, I presume, so the 18 to 24-year-old youth will be able to be served at Mary Greeley, which we sure appreciate. And the campus that YSS is building won't quite be the level of care of a hospital setting, but we do anticipate and hope that youth that might otherwise be admitted to the emergency department will be diverted because they don't belong there, and that they can come to YSS's crisis stabilization program. Similarly, youth that maybe present to the emergency department could be referred to our crisis stabilization program.
Yeah, Andrew, you mentioned earlier the business model for youth. It just is not a good one right now. And April was talking about, yeah, it'd be great to replicate that. I think the difficulty we as a hospital had historically is finding those adolescent psych providers, right? They are much harder to come by. And then when we looked at the volume of activity, most of the kids that ended up in our emergency room weren't anywhere close to us. They were coming from other parts of the region in the state, and and so it's really difficult. We, before this new unit opened up, and yes, it's nice and it's going to serve more patients. Um, we were turning away 250 adult referrals a month. This isn't going to solve that issue either. I mean, yes, we will be able to treat more patients, but we're still going to have an underserved population throughout the state.
Brian, do you have any thoughts? Because we've talked about a child and adolescent psychiatrist. I know that you are involved. Mary Greeley's had some success recruiting psychiatrists. What it would take for this community to get specialty focus on child and adolescent psychiatry?
You asking me that, Andrew?
Yeah, kind of. I mean, I just know you're the closest to recruiting docs to town that could do that. I just wonder how far away are we from, or what would it take to get that sort of specialty here in Ames? Mary,
Well,
or otherwise.
I think it's part of the conversation that needs to occur with the region, quite honestly.
Okay.
Yeah, because why we could maybe take a lead on a recruitment. We don't have the full-time need, right? But there's others in the community. And if Ember is going to have some need or level of capacity, or other outpatient treatment facilities, because we've talked a lot, it would be great. Ideally, from a mental health standpoint, where's the best time to try to address that? And you mentioned it early on. It's at the youth level, because it manifests and builds over time and ends up in the adult. So we should be really focused on how to prevent that from growing and manifesting over time. And I think we would be willing to partner with others in our region to help make that happen.
Yeah, thank you. I feel like an hour's time is not sufficient, right? There's a lot more questions that I have written down. I would imagine there's others that would love to put some questions in the chat here, but alas, we're running up against time. So, I would pose this to our panelists. And certainly just throw out any ideas you can think of at this time. How can the Ames Rotary Club, lead or partner in any initiative, and perhaps, this is the one, right, that's been identified, that the child and adolescent psychologist, because a few of you have now kind of mentioned that specifically as a need or perhaps a barrier to addressing the youth mental health issues. So, and Julie, I'll I'll put you on the spot first. How do you think that the Rotary Club could lead or partner in these initiatives to move the ball on this one? What do you think?
Gosh, I guess just, continuing to have these conversations, and, how do we find or allocate more funding for more bodies, I guess, is really what is needed, right? I really think, sharing these sobering statistics and, sharing these true stories of what's going on, and then you really, I don't know how else to say it. We just need more bodies. And again, I'm thinking about, at the high school, a couple social workers, that's not enough. And I can tell you that a year ago, I sat with a social worker who said to me, Julie, I cannot even get to the kids that are moderately struggling because I am spending my time literally every day making sure that some of these kids don't die. And I can say the same thing in my own job. I don't like it, but I'm triaging all the time. And I wish that I didn't have to do that. I mean, there's only so much that any of us can do. And the need is very, very, very high. And I think probably I would say too, just having folks attend mental health first aid classes. Those are free. The assist training. I'm learning more about mental health, being a voice to, no longer have this stigma. But like I said, I mean, if we can magically make some money appear, that would be great.
Okay. Kinsey or April?
Oops, sorry about that. I would definitely say a lot of those classes and things that Julie mentioned would be really helpful for people, just to have less stigmatizing language around mental health, to learn signs and symptoms, whether that's in yourself or the people around you, coworkers, friends, family members, decreasing the stigma by really relating everything that we talk about with mental health back to physical health. So those are really good places to start. That mental health first aid class, which is an 8-hour course on mental health concerns, and then assist, which is a 2-day training on suicide prevention. I think those would be really good places to start.
Thank you.
Yes, I agree. I think the more we talk about it and the more comfortable we get talking about the uncomfortable, we can all make progress in moving forward with decreasing the stigma that surrounds mental health, and in turn prevents people from getting the help that they need. I think that mental illness costs our society a huge amount, and realizing the investment that is maybe needed to, in any other crisis, if it were a pandemic or a natural disaster, we would be putting our funds towards things like that. And we just need to look at mental illness and the crisis that we're in right now as being on the same level. So I think just talking about it, all of us can be advocates for mental health. You don't have to have that title in your profession. We can all advocate for youth, for family members, for friends, for neighbors, and be that voice and be that advocate for them.
Well said. Thank you, April. Andrew, I'll let you finish off the conversation today with your thoughts on how Rotary can lead or partner in this effort.
Yeah, thanks again, Mason, for your leadership on this and everyone's attention. I don't think any of us have the silver bullet, know what the right solution is, but just the conversations make a huge impact. Was Don Brochard, was he a Rotarian? Even if he wasn't, let me invoke Don, who passed away a year ago this month. One of my mentors, somebody who encouraged and supported me, had been on the board for many, many years. And one of my first board meetings, I had talked about how YSS's mission, our goal is to help youth become productive and contributing members of society, something like that. And Don pulled me aside afterwards and he said, Andrew, you're going to be great at this job. I'm going to support and encourage you. But our job is more than helping youth become something. Our job is valuing youth as they are, encouraging them where they are, giving them voice as they are. And so I'm remiss a little bit to have this conversation on youth mental health and to have not encouraged us to have young people at the table. But my hope for all of us is that we live in a world where youth are valued and empowered to stand strong. It is the vision of YSS. And so asking young people to participate, giving them a seat at the table, understanding that treatment works and recovery is possible. And for many people, like myself, part of my treatment and recovery was George asking me to sit at the table and help put together solutions for issues that were facing myself and my peers. So let's just continue to be encouraged that there is hope. I'd love to see us coalesce around the idea of recruiting a child and adolescent psychiatrist. You've got, Gary with the Mary Greeley saying they'll help lead the recruitment. I do believe that there is will from the region. And I think that a powerful group of business and community leaders like Rotarians could help push us across the finish line.
Excellent. Thank you. Again, thank you to our panelists today. We really appreciate not only your thoughtful perspective, but all of your activity in helping our youth and young adults throughout the community. And I just wanted to share just a kind of a final personal note. So really, why not only is this a focus for Rotary International, as if you've watched Gord McNamara's kind of intro speech, but this was very personal to me because I've got a sixth grader now who was in fifth grade last year and was just struggling very much so with mental health. And neither my wife or I were equipped, right? She's a physical therapist. She knows how to heal the body. I'm just a dad. I don't know how to help with the mind. I was the one coming in saying, "Hey, just suck it up. You're fine. We'll get through this." But when we're in the Ballard School District, and they're great, and LifeWorks is kind of the organization that they contract with and have some counselors at the schools. But by the time we had got there to them, our son Maddox was 11th in line to receive services, and I would put him in the kind of moderate category. So didn't necessarily need what could be qualified as triage. He wasn't in a position where he was going to take his own life or anything like that. But he was 11th in line. And so I thought about, well, what about the other 10 kids that are in front of him that aren't able to take advantage of these services while they're in school, right? Not everybody has a job that's flexible like mine to be able to maybe leave for an hour or two and take your kid to see someone or get some tests done. So that's why I was kind of inspired to have this topic and make it a focus of my year as president, and hopefully it will continue on from there. So just wanted to share a little personal note as to why this is important to me. Anyways, well, again, thank you to the panelists. Thank you all for asking questions and participating. Reminder, we will not have a meeting next week as it's Labor Day, and then we'll actually be following up again with kind of our round 2 of and perhaps more conversations, hopefully more conversations to come as it relates to this topic. So with that, I'll go ahead and close the meeting, and we'll stand and recite you can stay seated, but I'll stand and recite the 4-way test of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? Thank you, and go Cyclones.
Thanks, everyone. Thanks, Mason.
Thank you.
Thank you.